In your cells right now, one gene is being read that will take 16 hours to finish. Most genes clock in at minutes. DMD spans more than 2 million base pairs, the largest known gene in the human genome. Its size is its vulnerability. The longer the target, the more often mutation strikes. 1 in every 5,000 boys is born with a deletion here. And without the protein it makes, muscles don't just weaken, they tear themselves apart.
The gene sits on the X chromosome at band XP21.2, and it makes dystrophin, a long, rod-shaped protein that lines the inside of every muscle cell. Think of it as a molecular shock absorber. It links the fiber's internal skeleton to the surrounding membrane and the extracellular scaffold beyond. Every contraction generates force. Dystrophin distributes that force so the membrane survives. Lose it, and the fiber quietly destroys itself with each beat.
In the early 1980s, the gene responsible for Duchenne muscular dystrophy was known only by what it took. In 1986, Louis Kunkel's group at Harvard used positional cloning, methodically narrowing the disease's address on the X chromosome, and pulled out a gene unlike anything they had seen. The following year, Eric Hoffman named the protein it encoded, dystrophin, for the dysfunction that follows its absence.
But the gene size created a puzzle. 2 boys could each carry a large deletion in DMD and have completely different fates, one severe, wheelchair-bound by 12, the other barely noticing weakness until adulthood. The difference wasn't the size of the deletion, it was the reading frame. The gene is assembled from 79 exons, and the code is read in 3-letter words. Delete a stretch that keeps the remaining exons in frame, and the cell still assembles a shorter, partly working dystrophin. That's Becker muscular dystrophy, the milder form. Delete a stretch that shifts every downstream codon out of phase, and the output is nonsense, the protein lost entirely. That's Duchenne.
Without dystrophin, every contraction micro-tears the muscle membrane. The body's repair systems fight back, but they fall progressively behind. Muscle fibers are replaced by fat and connective tissue until contraction is no longer possible. The heart and diaphragm follow the same trajectory. Boys with Duchenne typically lose independent walking in their early teens.
Duchenne muscular dystrophy is the most common fatal muscle disease of childhood. Before corticosteroids extended prognosis, median survival barely reached the mid-20s. With modern supportive care, steroids, ventilators, cardiac medications, many patients now live into their 30s and beyond. But living longer with the disease is not the same as treating it.
The reading frame pointed toward a fix. If out-of-frame deletions cause Duchenne, then forcing the splicing machinery to skip one additional exon, jumping over the deletion site to land back in frame, could convert a Duchenne mutation toward the milder Becker pattern. The first exon-skipping drug, etoposide, targeting exon 51, was approved in 2016. 3 more antisense oligonucleotide drugs have followed, each targeting a different exon, together covering roughly a third of all DMD patients. Then, in 2023, the FDA approved the first gene therapy for the disease, delandistrogene moxeparvec, a miniaturized dystrophin gene delivered directly into muscle by a viral vector. For the youngest patients treated before significant fibrosis, it can restore what the deletion took.
Guillaume Duchenne described the disease in 1868. The gene was found in 1986. The reading frame explained the variability in 1988. The first drug was approved 128 years after the first patient. DMD is the story of what happens when a gene is too large to stay intact, and what happens when scientists understand why it breaks well enough to start writing the fix. The Gene Channel.